here in Manhasset, Long Island, as a participant in the North Shore Long Island Jewish Nursing Education Conference. The theme of the conference this year is Preparing the Next Generation of Nurses, the Organizational and Academic Perspective. They have some fantastic presenters, and it's a collaboration between hospital-based educators and, of course, those educators that are in the academic facilities or academic sites in the greater New York area. I'm really looking to hearing about the collaborations and some of the new ways of reaching nursing students, but also collaborating with the organizations in that smooth transition. There's also going to be speakers that are going to be talking about academic preparation through the career of a nurse from baccalaureate all the way through a DNS, so it should be very exciting. So I'm with Joanne Knazel, Assistant Professor of Nursing at Pace University. She's just given a presentation on the Sim Lab and working simulation into nursing education. Joanne, that was fabulous.
Thank you very much.
Can you talk a little bit more about how the Sim Labs add an extra layer of dimension to the conventional nursing education program?
We try to use the simulation as an adjunct to the didactic or classroom activities that the students will have, and really have them take that leap of faith and practice skills and put theory into practice when they're in the sim lab.
Right. And what I heard you speak about that I was so engaged with is that, you're using nurses who have recently graduated your program in the sim lab as nurse interns.
Yes.
Talk a little bit about that.
We were really stuck for personnel, for staff to help us with our simulations, and also to help with students tutoring and practicing of skills. And we needed someone with a flexible schedule, with knowledge of our program, and nursing knowledge. And these students, former students, new graduates, were available and were raring to go, ready to start working. So it was a win-win situation for all.
Did you find it easier for them to relate to the nursing students, taking away a little bit of that intimidation of an actual professor on, right there?
Absolutely. They had a very comfortable rapport with them. The current students really look up to the nurse interns, as we call them, and look at them as role models, and know that they were successful in the program and that they can be successful as well.
Fabulous. Great work. A wonderful presentation.
Thank you very much.
So I have with me Barbara Callahan, and Barbara is a PhD candidate. She is also the Director of Education at the Long Island Jewish Medical Center. And I wanted to speak to you, Barbara, about nurse champions and how nursing education figures into enhancing that practice.
So thank you, Phyllis, for the opportunity. Nurse Champions, we look at different programs that we put Nurse Champions in, and whether it's our skincare program, whether it's our diabetes program, whether it's our gerontology program, we take nurses that volunteer to be in the position, who have a passion for those different types of topics, provide them with education, and in turn give them clinical scenarios. And then once they graduate from the program, we utilize their expertise and their skill set in taking care of patients. And in turn, they benefit our outcomes tremendously.
So talk about that. Talk about the whole connection between nurse champions and clinical outcomes.
Sure. So with our nurse champions that are pressure ulcer champions, they wear special red coats and Wednesdays, Wound Care Wednesdays. So they evaluate our patients that have pressure ulcers, and they teach our staff also in the care of that particular patient. And because they also monitor documentation and are on top of our patients with pressure ulcers, our pressure ulcer rate decreases because they educate the staff. And for our diabetes champions, we try to decrease our recidivism rate of those patients with diabetes by ensuring that these patients are thoroughly educated upon discharge, and they know how to do their insulin pen, and they know how to take the finger sticks. And in turn, the nurses calculate their hours so that they can sit for the CDE exam later
Wonderful.
on.
Wonderful.
So it is a win-win situation for our patients, our staff.
So I know Long Island Jewish recently got Magnet.
Yes, we did.
Okay, congratulations.
Thank you.
And how did the champions play into that Magnet journey?
Many of our documents within the Magnet application process talks about our champion programs, both with skincare and diabetes. And in turn, many of these nurses were our Magnet champions. So they shared their stories with their surveyors. The document also totally describes what they've done as a role. And in turn, these nurses went to the Magna Conference. So it's a whole circle of acknowledgement and of the great job that they have done, and it really helped us in getting our Magna designation.
Fabulous. Congratulations
Thank
to
you very
your
much.
team, and of course to Long Island Jewish.
Thank you very
Okay.
much, Phyllis.
So I am with Dr. Lornette Wolford, and I just sat through such an amazing presentation about dedicated education units. Now, Lornette is the Director of Nursing Education, among other things, at the North Shore University Hospital, and has really, she and our other of our colleagues have really pioneered this DEU concept, and I really wanted to talk to you, Lynette. I mean, congratulations.
Thank you, Phyllis.
It was extremely heartwarming to hear, you know, how you're helping student nurses really hone their skills.
Yes.
It almost seems like a very warm invitation to the profession.
Yes.
And creating a very nurturing environment for them to get down fundamental skills, to be able to ask questions without feeling that hesitation or that angst.
Yes.
And giving them a sense of belonging as a student into a profession, which I imagine they're going to carry through professionally. So please, just speak a little bit about it for us.
Well, it was really my privilege to be part of the DEU at North University Hospital and Adelphi University. And I think, as you heard from our student Samantha Avila, who spoke earlier, the DEU provided them an opportunity for those students to really become immersed in the North Shore University culture. They formed relationships with their preceptors that were comparable to none. I mean, as she mentioned, they would call one another. The preceptor would contact the student if she wasn't coming in, the types of things you don't see in traditional models. The relationship that existed between the student and the clinical instructor, who is the staff nurse on that unit, really alleviated all fears that the student had. I would have these DEU students tell me over and over that they weren't afraid to ask their preceptor 2, 3, 4 times, what was that again? How do I do that again? And that sort of comfort is necessary, because transitioning into practice as a registered nurse is very challenging. And we do expect new graduate nurses to onboard a lot of skills in a very short period of time. So having these 2 years of intense preparation, I think, is comparable to none. Quite frankly, if I had it to do over, I wish I could have been in a DEU student when I was a nursing student.
Well, I second that. One of the things that I was struck by the program that you shared with us was some of the fundamental skills, and you were talking about vital signs,
Yes.
turning and positioning, inserting or Foley care,
Yes.
in care of an IV insertion site, and I think personal protective equipment and universal precautions was there as well. And what a great way to segue into some of the major metrics that we are monitoring now that are nurse-specific indicators of quality.
Correct.
And getting those anchored from the get-go. You don't even have to be an employee. You're anchoring them as students. Can you speak more about that?
Yes, and I'll tell you something that I found to be remarkably beneficial about conducting a research, or I should say partnering a research methodology with our DEU, was this ability to investigate how the students were experiencing learning. Because in a traditional model, or without this research methodology and partnership, the nurse educator or clinical instructor is not able to differentiate one student's experience from another. So if I am trying to determine whether my student has met expectations with regard to the ability to utilize universal precautions behaviors, I don't know. I'm not gauging that on whether they did it 1 time, 10 times, whether they put on a gown but not a mask. So in other words, the whole activity or a part of it, and or whether someone helped them do it or they did it by themselves. So understanding these important variables with regard to learning is hugely important, because watching someone perform Foley care
Right.
and actually
doing it.
performing Foley care
Right.
are 2 different things, yet the student gets the same measure of meeting expectations whether they do one or the other.
Right.
So this provided us with insight that we'd never had.
Right, I just can't help but think, knowing that you've hired many of your graduates
we're very
from the
happy.
DEUs,
Yes.
that your metrics are going to reflect that right from the get-go. So I just want to say that when I travel the country and I'm asked to speak, especially on bullying or nurse-to-nurse hostility, or when I am coaching nurses who come to me who have been on the receiving end
Yes.
of hostile environments, I'm always asked, well, what do you think might be an answer? And I have to tell you, after listening to the presentation that you and Donna did, that I think the DEU concept is a beginning.
I think you're right. Sometimes some of the information that I heard or concerns I heard from others who are not familiar with the DEU was, well, boy, the student's going to be on one unit for this extended period of time. Are they being shortchanged because they're not having the opportunity to go to other units and gain experiences in other settings? But I think that the trade-off of being in a unit where the staff gets to know you, you get to know the residents, you get to know that culture, that's irreplaceable. Because when we look at the data, for example, around new graduate nurse turnover and those first 3 to 6 months, which are the most tumultuous, a lot of what those new graduates face, yes, is the onboarding of clinical skills, but it's the socialization into the environment.
Thinking like a nurse, thinking like a teammate.
And that's what gets in the way and
Right.
makes their transition
Right.
a whole lot harder.
Right.
So having the ability to eliminate that, is really rewarding, I think,
Well,
for those of us who are involved
I think
in
you
it.
substitute hazing for nurturing,
Yes.
and I am a big
Yes.
advocate of that.
Yeah.
Thank you so much, and congratulations for your work at North Shore.
Thank you,
Excellent.
Phyllis. It's a pleasure.